Hello, everybody, and welcome to our webinar. Really excited that you're here. My name is Judy Browse, and I'm the Executive Director of the North American Association for Environmental Education, or NAAEE. And today, I'm so excited to have you all here for this webinar, which is all about One Health, connecting nature, community, and well-being. And it's really going to be a very informative session. And I know that a lot of you know about One Health and the One Health movement, and others are just starting to learn more. And today we are going to hear from two amazing conservation and community engagement speakers who are both working on One Health initiatives, and will help us understand more about what this movement actually means. And for those of you who are coming from the environmental ed field, you know that EE is interdisciplinary by definition. It's focused on sustainability, where we're talking about, can't talk about environmental integrity without talking about community well-being and shared prosperity. But sometimes the health piece isn't highlighted. And so we're going to better understand those health connections between human health, ecosystem health, animal and wildlife health, which is what today is all about. And before we get started, in the chat, if anybody knows when the term One Health was first coined, put it in the chat. Do not look it up. If you know it, put it in the chat. We'll see if anybody knows kind of when it started. I'll give you 1 second. Any guesses? Ooh, good guess, Beth. 2008. Steph, we have it. Ooh, we have the 1970s. We have 2019. 1890. I love it. 2003. Okay, we have a winner. It's Nishant. It was 2003 when the word first came out. Now, you can all check this, but it was in the Washington Post, which is my hometown paper here, where it was talking about One Health, that we need to really think about how human or livestock or wildlife health can't be talked about in isolation. So it was in the Washington Post, and it was also the Wildlife Conservation Society talking about it. And Roger and Jaime are going to tell you a lot more. And we do have two wonderful presenters, Roger Still and Jaime González. I'll introduce them in just a minute. But first, just some housekeeping. I want to thank you all for sending in your questions. We will get to as many as we can. So thank you so much for taking the time to do that. Excuse me. And then for those of you who are new to our webinar series, we are trying to bring every month new ideas, new insights, new speakers to help us all keep up on everything that's going on and learn new things, think about things differently, and have speakers who are provocative and it can help us think about the future. And I want to thank all our affiliate co-hosts across North America. And if you're not a member of your affiliate, please check it out. They do the work we do at the state, regional, and provincial level. So thank you all for all your support. Thanks to US EPA and E360 Plus for their support of this webinar series. We really appreciate that. And just want to remind you, it's a webinar, so that's why you can't see anyone but the speakers. But please type your questions, your ideas in the chat throughout. We do have closed captions and translated captions, so you can click on the CC. And this webinar is also being recorded and shared, so you'll get everything, the presentation, the recording, and the chat. And the toolbar has the chat and it has the closed captioning if you need it. I know we have people from other parts of the world. English might not be your first or second language, and there are 31 different languages you can choose from that will help because some of us talk very quickly. I also want to give a big thank you to Carrie, who is our Senior Communications and Data Specialist. Carrie is amazing and she helps support the webinars and so much more. And she's an analytics specialist. So just so many talents. Thank you, Carrie. And now the good part. I'm going to introduce our speakers very briefly. I love this photo of Daddy Longlegs, but I'm going to introduce Roger and Jaime, who are our two speakers today. And let me just start with Roger. I'll introduce them both at the same time here and then turn it over to Roger. And Roger is a wonderful friend and colleague, and we first met during our days at the National Audubon Society. Roger is currently the managing partner at One Health Advisors. He is a conservation leader with more than 25 years of creating partnerships and securing resources for large-scale initiatives. He's a big thinker. He was the state director of the Nature Conservancy of Missouri, and he was a senior executive at the National Audubon Society, and he helped launch two Audubon centers, one in St. Louis, one in Joplin, and he helped lead the Mississippi River Initiative across 10 states. Roger has also served as a consultant to many organizations, including the Roy and Patricia Disney Foundation, the Winston Family Foundation, and so many more. And you'll hear more about his work with One Health and how he is currently piloting a next generation One Health approach in his community with support from the Missouri Department of Conservation and the Missouri Foundation for Health, trying to bring private finance to benefit rural communities in Missouri and landscapes across the state. So we're so thrilled, Roger, that you are here. Oh, and I didn't even put your slide up while I was talking. I am so sorry. All these good things, including the fact that your work in Audubon with the Mississippi River led to the whole Flyways initiative. You did so much while you were at the National Audubon Society and at TNC. So an amazing background. So thank you so much for being here. And then we have Jaime González. So let me go here and I will click to your slide. And Jaime is a talented conservationist, educator, connector, naturalist, really a creative change agent in our field. Jaime is the chair of the NAAEE Board of Directors, and I am so lucky that I get to work with him in that capacity. He is the executive director of the University of Houston's Institute for Ecological Resilience. And that's a new position that fits his love of ecology, education, and conservation. He has won numerous awards and recognitions, including the 2019 College of Natural Sciences and Mathematics Distinguished Alumni Award from the University of Houston. He co-founded the Coastal Prairie Partnership in 2009. He has served on the Wildlife Diversity Advisory Committee for Texas Parks and Wildlife and works with so many other organizations. And he is always involved in promoting and implementing policy and projects that embed nature-based solutions into Houston's urban fabric to create a more resilient, healthy, equitable, and enjoyable city and region. He has also been a huge supporter of ensuring that everyone has access to education and nature, no matter where you live. So, Jaime, welcome. Thank you so much for being here. And I'm going to turn it over to Roger. Thank you again, Roger, for being here. And here you go.
Thank you, Judy. Delighted to work with you all those years ago at Audubon and for your leadership of NAAEE, Jaime as well. And just happy to be here today and talk about One Health, kind of defining it, and also how we're executing it in my community in the middle of the United States. But I wanted to start, and I wish I could reach through here and reach everybody. Can't see you. But I wanted to reach back in time where my love of nature and kind of One Health started. This is my grandparents' farm in 1974. And when I used to, in rural Missouri, in the Missouri Ozarks, and when I used to crest that hill, that was the happiest place in the world to me. And now, as I'm ending my career with this sort of One Health integration, I'm going back to the beginning. Nature, agriculture, community, all together in one place. And it's stuck. There we go. Whoops. Sorry. Went forward. And there I am on that porch in the Missouri Ozarks long ago, coming from the city where my grandparents where I'd moved as a small child. And my sister, my grandparents, it just gave me a love of all of these aspects that go into a thriving human life rooted in that time period when I was a little boy. Where do I live now? I live in mid-Missouri, Boone County, Columbia, University of Missouri is here. And it's a community that's a classic college town. It's a real good incubator for innovative approaches like One Health because we have a college town that's very friendly to that, but we've also got rural populations the University of Missouri, and a robust healthcare system here. So when we're looking at the integration of health and nature, it's a really good place to try to innovate and do new things. And really big picture here, we need to innovate and do new things because this Venn diagram, a classic One Health diagram, shows what's happened since I was on that farm as a little child. Cornell Lab shows us that we've lost over 3 billion birds, almost 1 in 4 since that time period. Related, a driver of that is we've lost over 1 in 3 farms during that time period. And that's had a real effect. That whole system has had an effect on us. Childhood obesity from 1 to 20 to 1 in 5. This whole system at that level of change, and we need in One Health to pursue this integration in policy, is something that's really, I think, part of the ills that we're facing in our modern world right now. And One Health itself, what's the response to that? Judy indicated the different elements of One Health, and we have, with support of the Missouri Department of Conservation, we focused on fundamental elements of One Health, not trying to do everything, but trying to create the health of nature. So that's part of our One Health definition. Health of nature for us, health of food systems, and health of food for us, and integrate that with human health. So it's that 1, 2, 3 in both of the projects I'm going to briefly talk to you about that we're pursuing. One of those projects, done in partnership with the Columbia Public Schools and others in our community, has the One Health pattern. And then, as Judy mentioned, Missouri Foundation for Health and a very much more innovative healthcare approach that I will highlight here. So, a completed project that we have in our community is this nature school, which is in southern Boone County, just south of Columbia, Missouri. This is a $6.8 million facility. It opened in August, and children are able to interact, mostly fifth graders, 2,200 fifth graders from throughout our county, interact with a sort of One Health pattern at this site. This site is next to a major conservation area just south of Columbia, about 1,100 acres, Three Creeks Conservation Area that you can see in the upper left corner. We secured a 111-acre donation, and there we have implemented the One Health pattern and are doing it as we speak. So you've got prairie restoration, that's the health of nature. Trails development for kids to go out and be in nature. We intentionally left elderberries there. Missouri is, glad to brag, the leading elderberry producer in the country. We transitioned that to organic production and connected it to a food forest and pollinator plot. And then the children's health and educational outcomes are being measured from the University of Missouri faculty. So that when we say One Health here, it's that 1, 2, 3 of health of nature, you in nature, health of food and food systems, and people, in this case, children consuming that food and then measuring the outcomes. A little just about how that actually happens on the side. The children, 2,200 fifth graders, go 3 times a year during the calendar, and they follow a curriculum that roots them in place and then shows them how they can be change agent by doing a sustainability project. So there are other ages that go into this in the future, but the core is those fifth graders, as I said. We also have a constellation of partners actively engaged on the site, and I would just point out the diversity of groups there. Not only the traditional conservation groups, but also the Columbia Center for Urban Agriculture, Master Gardeners, and all led by the Missouri Department of Conservation, who helps restore the site and engage the community. And the Columbia Public Education System, which actually owns and operates the school and pays for it. So very excited to have this in our community, and it forms a template for what One Health in action in a community can be as we pull not only all those elements together, but all those institutions as well. So now I want to transition from that completed project to one we're really innovating towards, and that we were able to break the silo between the funding and the conservation side and the Missouri Foundation for Health, which is a $1.6 billion funder in our community. They were seeing, in our state, they were seeing the growing importance of nature in an increasingly digital era, and wanted an innovative project. And we were fortunate to frame out what I'm going to be talking to you about and get that support. And we're in the middle of that process now. I wanted to flag as part of the context of that that this is a growing movement. I'm sure many of you have heard of the Nature and Health Alliance. If you haven't, I would look on their website. This is a group of mostly researchers, but also practitioners from throughout the country that had their inaugural conference that actually Jaime spoke at earlier this year in April. It was the very first time all those folks have gotten together about this intersection between nature and health. And we're using and partnering with a group called NatureQuant and also the American College of Lifestyle Medicine to do the project that I'm going to describe here in brief. NatureQuant is an organization that takes over 30 data layers, and it frames out nature deficit areas and nature rich areas for in a proprietary fashion. They're a private company, but very open about their data, and they collaborate with a lot of researchers. And we were able in this project to look first at countywide public health and collaborate with the public health department to use NatureQuant to identify where are those areas where we know the research and NatureQuant's analysis shows that if we increase nature, we're likely to increase public health outcomes in our community. All as a pretext, a precursor to public health intervention strategies. And we're actually moving. Speaking of the title of this, In Action, we identified a nature deficit area in our grant with the Missouri Foundation for Health. We received funding for a small grassroots organization in the heart of underserved Columbia, Missouri to participate. We framed out where are those nature deficit areas. Well, one with Centro Latino's headquarters and community building there is on this empty lot. And so we rallied the community and partners around it to do a tree planting in this neighborhood that we know the analysis shows they need more nature to be healthy. And then related to lifestyle medicine that I'll describe more, in the community center itself, serving neighbors and members of Centro Latino healthy, nutritious food. Again, the One Health pattern in action using NatureQuant as a tool. And ultimately, we plan on doing a public health campaign for nature. We all remember, I think, or at least we historically know that smoking used to be so prevalent in the United States. Public health campaigns change that. And we are planning to do, together with our public health department, a public health campaign to take on a modern problem, which is what we know are bad outcomes for children and adults in the use of social media and technology. And we probably are going to need to have a kind of hard-hitting campaign like they did to juxtapose the unhealthy behaviors like being caged here with social media, much as we did in smoking in a prior generation. Now to get from, so that's the public health level innovation, is collaborating with public health as a movement. Now I'm going to finish by moving to a site level and an individual health level. And we're in a society now in which the food system, our lack of connection to nature, lack of connection to housing, community, our physicians, and I've gotten to know a lot of them through this process. Our physicians are just mopping up the problems that have been created in the kind of context that surrounds our lives on a daily basis. We aim to try to change that through a focus on lifestyle medicine. Lifestyle medicine is an evidence-based movement that has 6 different pillars around it. And it's just common sense in many ways and preventative steps that we need to take in our lives to be more healthy. And the American College of Lifestyle Medicine, which is around the country, has about 50 staff. They formally have a Nature is Health or Nature is Medicine subcommittee. So they really embrace the healing aspects of nature. Where are we doing this? And this is another key element of our innovation moving forward, and it goes back to the One Health pattern I described at the beginning. In a 201-acre park in our community, in an underserved area, we are doing a One Health demonstration site and plan on having a lifestyle medicine clinic that prioritizes the health healing benefits of nature there. What have we done on the One Health pattern so far? We have done an ecological assessment of the site and are developing an ecological management plan. We're going to have a farm business ecologically aligned from the standpoint of the way those production methods are done, but we're also planning to have that kind of food as medicine, that building in connections to our healthcare systems in the community so that the food created here, hopefully recruited with farmers who are underserved, are able then to move into our supply chains as medically tailored groceries and medically tailored meals. And then the centerpiece of this would be a lifestyle medicine clinic that we're doing business planning for, including having identified the clientele that we need to reach based upon our healthcare data in our community. We're doing business planning, and we are going to focus in this clinic a mental health, chronic disease, and maternal health will be the populations that we will especially be aiming to serve. And how might this relate to the field of environmental education? There's also a kind of hybridization of work here. This would be a group medical clinic model. In our current medical system, you go to see a doctor, they give you a pill, they often only have 15 minutes. This would be a group medical visit model where people do things together in community about behavior change and becoming healthier. And the American College of Lifestyle Medicine's been helping us with this, and there would be those kind of health functions. But a lot of the activities would be what we would traditionally feel like our environmental education, everything from bird watching, plant identification, outdoor work, and including gardening work as well. So we're developing the program for that as we speak. And finally, we started this about 6 months ago wondering, can we align insurance reimbursement? Can we really make a model happen? You can't actually charge for nature. And that's been one of the issues with the nature prescriptions and getting them to scale around the country. What we found in doing our business planning is that there's a lot of chargeable things in our healthcare system, Medicaid, private insurance, that we can actually be able to charge and have a sustainable business model. We think we're on that, and our consultants think we're on that. So hopefully, between that sustainable business model, raising private money and public money to build this small clinic, that would have a staff composition like this, that would, yes, have a physician, but also have health coaches and people that are knowledgeable about the environment, but understand how that connects to human health as well, would be part of our model on the site. So that's what I have. I really blitzed through this. I wish I could see your faces. Judy, you're the best. Thank you for giving me this opportunity. I'm going to start posting a little more on LinkedIn. I've already started that a little, so do not, thank you for the kind comments in the chat, by the way. If you want to connect to me on LinkedIn, even if you only know my face here in my house, feel free to do it. And look forward to connecting, hopefully in the future together. So, Judy, that's what I got.
Roger, thank you so much. I want to move there. Oh my gosh, and lose in tennis again. No, I want to move there. Thank you so much for that. Let's just take two quick questions and then we'll move on to Jaime. Sarah asked about any ecosystem health benefits that you've been able to see on the ecosystem side, because you've got a lot in there. And then the other question, just so you can think about it, what was the hardest part of developing the nature school using the One Health model? So those two quick questions.
So ecosystem wise, I mean, it's just pretty traditional work I'll do both the nature school and removing invasive exotics. We paused during COVID on the project, so that was very hard. So there we've removed a lot of the invasive exotics with the leadership of the Missouri Department of Conservation. The area there's a cave karst topography, so we designed the building in a manner that was sustainable and had water retention features. So that's the ecological outcomes there.
Yeah.
To be honest with you, the park that is then that we want to put the clinic in, we've just done an ecological baseline. So we haven't actually gotten ecosystem results there now, but we have a very robust baseline of ecological data. And that, I love the question because, the healthcare community, I mean, with all due respect, they don't pay much attention to ecology. And so, if we can, what I found is that a lot of physicians want to learn more. And so, we're not only laid down that ecological baseline, but are also doing restoration. Then, what was the question, Judy? Sorry.
The other one was, no, and we've got a lot more coming in. So at the end, we'll ask others. The other one was just there are so many that have come in, any insights into what was hardest as you developed the nature school and connecting it to One Health?
Yeah, so one hard thing is this happened over a course of about 12 years, as Judy knows. I think I visited two or at two different junctures. So we originally were going to put it in a state park, and then our governor and a state senator at the time got in a big argument that, well, if we did this in one place, wouldn't that set a precedent elsewhere? And so without that just it just died. And my friend Sarah Parker Pauley, who was the director of the Missouri Department of Natural Resources at the time, when she came over to the Missouri Department of Conservation, she said, "Hey, Buster, we're going to get this done. We're going to restart this." And I would say that the hardest thing was just, I mean, we had to go through COVID, it's
Yeah.
raising some of the private money and all of that. The One Health model, I would just say that there's a bit of a retrofit here. Kind of this, more than kind of, this nature school actually inspired the One Health framework
Yeah.
focus.
Okay.
So it was really kind of the other way around. I'm actually speaking at the nature school tomorrow, full circle. I'm speaking there to all the educators and a lot of people about One Health and our project. So we're very proud in this community that we've got 10 miles away from each other, these two kind of exemplar One Health projects.
This is so great to see two concrete examples of what this means. So there are other questions we'll answer it. If you want to answer any in the chat, you can. We had questions about how to make the site, how are you making the site accessible and all kinds of other things. So we'll get back to that. But thank you so much. And I hope the talk tomorrow goes well. And I think you're going to have a lot of LinkedIn followers, Roger, after this. So now we are going to turn it over to see another example of what's happening in another state with Jaime González. I'm so excited you are here with us, Jaime. Welcome, welcome. And I will try and keep up with your slides here. This is beautiful, by the way.
So incredible presentation, Roger. That's just so inspiring. And what I'm going to do is I'm going to talk about a few other things. Sorry, I don't have my camera on. All right, there we go. And what's happening in Harris County. So Harris County is in Southeast Texas. It's the home of Houston. And it's part of a metro region that's about 7.7 million people. It's also one of the most climate impacted cities in the US. We've had around, not all of them directly attributable to climate, but some definitely enhanced by climate change. We've had 18 natural disasters since 2000. And so one of the things I think that is calling out for One Health action in Harris County is just this continued interbreeding of issues with declining species, with climate, with public health issues, with environmental justice issues. All right, Judy, so go ahead and flip forward. So what if we, instead of seeing this as a purely a conservation issue, which Roger and I came from the conservation field, still conservationists, what if we saw it as kind of this more kind of integrative approach using a One Health approach? So, for much of my career, I was told, we got to build the conservation tent larger, and we do. But what if we think about being in a more of a One Health kind of campground and working together? So we have a very nascent, very early on One Health action team here in Harris County. So it's not as far along as Roger's stuff. But we did a couple of things early on to kind of draw interest from different sectors. All right, go forward. So what is One Health? Roger described that intersectionality between human health and well-being, environmental health, and biodiversity or animal health. So next. Oh. Yeah. So one of the things that we're going to try to do, and Roger already said this, is to aim to have optimal kind of health outcomes for all residents. And what this does, when you see it through that lens, is it forces you to think a little bit differently, oftentimes in terms of urban planning, which is typically when we describe a community in an urban planning context or an urban policy context, we're typically talking about just the people, and nature herself is kind of seen as secondary, or not even on the list of stakeholders, as it were. But this is one of the things that it does encourage. All right, next. So I always try to, as we go into any process where we're really trying to better understand, like, what are all the intersectionalities between the people and the rest of nature, I try to use residents as broadly as I can. Click. So these are the real residents of a community, right? It's everything that's interjoined, and also to kind of point out some of the what I call really moments, really One Health moments, because I think that one of the primary functions of environmental education, right, is to draw back that connectivity between our health and environmental health and the health of the planet and biodiversity itself. And so when you start to start to do this kind of planning work and project work, continually trying to tie back the fact that a community is more than just the people is oftentimes, it can be challenging, but it can also be kind of enlightening. So next. Okay, click. Next. So one of the things that I think is kind of most promising about a One Health approach is that it can bridge different communities that oftentimes don't talk to each other very much. So here in Houston, the conservation movement and the environmental justice movement are both robust, but they don't have very many interactions. And we have a very large public health sector. And as Roger pointed out, there's not a lot of understanding sometimes of the ecological value of what's going on locally, and vice versa. Sometimes with conservation, there's not as much understanding about public health. But we also have indigenous folks here. We have communities. We have a very large faith community. So how can we situate a table where more people can interact around this idea that what I say is that if nature is sick, people can't be healthy. Next. So one of the things is on this diagram that I'll point out, right, and Roger got to a lot of this, is that these kind of intersection zones are where we typically are working when we're trying to tackle some of these issues. And that One Health paradigm really is how do we get to some of these things right in the dead center of the diagram, in the One Health section of the diagram. All right, next. So I do have to give a shout out to the University of Alaska at Fairbanks. If you want to learn a little bit more about One Health, they have now like 3-course program through edX. I'm not saying that you need to go with that platform, but it really opened up my eyes to what was going on, because what was going on during the pandemic and then post-pandemic, as there was a lot of talk about justice, about equity, about other things. And from the traditional conservation side, we were all trying to kind of learn, like, how do we operate in that space more effectively and attune to things like environmental justice and things like that. And so this class came out and started forming a relationship with that center there for One Health research. And I thought, yeah, sounds a lot more like what I'm doing in the work that I was doing at the Nature Conservancy at the time. It sounded more like the intersections that I was seeing as a practitioner. All right, click. Next. And just wanted to give a shout out to some of our team here, some of the key players here in Houston, Dr. Colin Geiselman and Carolyn White, Isabel Asakura. And this is a very much a growing kind of movement. We have a One Health action team that meets once a month. And what we're trying to do is kind of set early priorities now that a few key tools are out. How do we expand upon those tools, and how do we draw in more people? So this is certainly not indicative of the kind of the richness of the folks that are coming to the table now, including the medical community. All right, next. So one of the main drivers for trying to create this One Health Action Hub or team, where there were multiple things happening all at one time. I was working on this action plan, Houston Conservation Moonshot 2030, with a person named Carolyn White and Colin Geiselman, who you saw earlier. And basically, one of the main things that came out of this study is that the conservation community was too disjunct from the rest of other things that were happening and other folks that are craving healthier, more abundant nature. And so that kind of pointed us in the direction of, like, if we're really going to do a better job of conserving, in a more traditional sense, some of the last remaining wild places in the region, that we needed to be more fully integrated with the rest of the folks that were looking to save and restore nature. At the same time, Dr. Colin Geiselman wrote this book which is really looking at how all of these systems kind of interact. So it was kind of a stream of thought that was going on and things that were kind of pointing us that way. All right, next. So in terms of One Health, and I think you got this from Roger's talk as well, is that it is something that can and should be used in project planning, in city planning, urban planning, policy work, and funding, in communication. I'm so happy to hear that he is thinking about a public communications campaign. There's something that we started before I left Nature Conservancy on a nature campaign, and I need to check back to see where that is. Evaluation and action. And so, I think that it's something that can also bridge, I think, some political divides right now, where there are obviously certain things that are seen as more divisive in terms of language, but health seems to still be, some parts of health seem to be a little bit safer place to go. All right. So what does it look like? All right, next. So one of the things that you will see in public health is the social determinants of health, and I don't have the wheel here, like what determines your health. And in a complicated place like Houston, or just about any place, you have this whole kind of sequence of things that determine how much and how healthy the nature you receive in your community will be, and how deficits in that nature can cause issues, sometimes these deep issues that we don't recognize as much. And Houston is the largest kind of unzoned city in the US. So you can have a junkyard next to residential folks. You can have any number of combinations of things. And so what that's done is it's created some areas that are more floodable, certainly some areas that are way hotter than other areas because disinvestment in parks or tree planting. You have some areas that are fence line communities that are right next to pollution sources. So you have all of these things. And so when we talk about One Health in this particular frame in Harris County, there are many things that are in nature that could be seen or can be dangerous, like hurricanes. We get those, we get floods, we get heat waves, we get all of those things. There's the zoonotic diseases like COVID-19. But what we're really trying to focus in on is where do we find more One Health equity in terms of the health and abundance of nature in communities, and how do we map that? How do we provide tools for that? But ultimately, how do we institutionalize One Health as kind of a way of looking at the world? All right, next. So one thing that was published just this year by my colleague Carolyn White, and you can find this online, it's through Harris County Public Health, is a One Health in the Built Environment Toolkit. And so she worked with myself and many, many others on this, but she's really the key driver behind this toolkit. And so what it does, it provides ideas and concepts for planning neighborhoods and communities and schoolyards and other venues with a One Health lens. And so there are many different pieces of this puzzle. And she did a really good job of kind of making it easy to understand, and so that you can use this as a planning toolkit, as it were. Next. One of the things that we also did is we created together a One Health index. So one of the things that hardly ever gets done is you don't, or never gets done really, is you don't plot kind of like what is the biodiversity health, the environmental health, and the human health on one map. So one of the things that we wanted to communicate from the beginning is that One Health is always in action, whether it's good One Health, bad One Health. But if you can't see it on the map, it may not kind of pop for people. So if you click to the next one, Judy, what we did is we took about 32 data layers, our team did, and that was everything from biodiversity, community science-driven data to climate data to social vulnerability data to health data, and we put it through this mixture. And we don't, we haven't published this yet, but we hope to at some point. And what we came out with was a One Health map of Harris County communities. So if you click to the next one, Judy, what you see are the blue are the biodiversity or animal health, the green blocks are environmental health, and then the red are human health and well-being. There's obviously a lot more human health and well-being pieces, and so it's easier to find some of those things. So we're not saying that this is the latest and greatest and the best ever, but what we wanted to do is just get a start. And so when you plot out Harris County communities on this One Health Index, what you can start to see is the cumulative score. The higher the number, the kind of more burden there is for that. So if a community scored in a not great way in the upper 25% for a variable, then they had a point added to their score. So by contrast, the highest score for One Health, not surprisingly, we're in some of the leafier, wealthier neighborhoods, and I think the lowest score going to 0 is better. It was an 8. So if you look at Cashmere Gardens, which is repetitively flooded and has other health issues and environmental risks, it scored a 23. So that's bad. All right, next. So one of the things that I'm trying to do is just trying to tell some of these One Health stories that sometimes are not told, and so they're not always understood by policymakers or funders or whatnot. And I participated in 2 heat mappings of Harris County, one in 2020 and one in 2024. And one of the neighborhoods that I've worked in a lot, you'll see on the next slide, has a huge deficit of tree canopy cover. If you go back one way, yeah. And so, yes, it is. It was measured in 2020 as 17 degrees hotter than the coolest neighborhood in the city. Nature also has issues, obviously, when there is a neighborhood that is that hot. And so you don't get the benefits of nature from a protective value, but nature herself starts to fade because it becomes very hard. I did 1,000 iNaturalist observations in this neighborhood. And on those 3 days, I only counted I think 7 species of birds and maybe 100 or fewer birds. It was crazy. So this causes stressors. And one of the things that there has been a correlation around is heat and violent crime, and how that can worsen when you start to get higher temperatures. And so the health of the tree canopy cover, nature herself, can code into things that cause other health concerns down the line, and then equity concerns. So anyway, flip to the next one, Judy. So we worked on a plan, and kind of like Roger's example of something kind of spurring a bigger conversation around One Health, the Greener-Galton plan, which we did several years back now, was really built around what does nature mean to people? Where should it be situated? And it was all because Galton, the neighborhood of Galton, is like this 60,000 people, mostly refugees and immigrants, but a real huge deficit in nature. And fortunately, the residents said, yeah, we want to go ahead and plan in a One Health kind of way. So whenever we developed the tree list for the neighborhood, we designed it in relation to what wildlife it might be bringing in, not just what is its cooling value. We talked about nature as a basic human right. And so now there's a lot of movement because of Harris County government investing and foundations investing in greening this neighborhood, which is fantastic. All right, next. This also can happen, and I'm so happy to hear about that nature school, because a lot of times, campuses are pretty boring. They're mowed. It's pretty hot to be outside. There's not a lot of interest or activity. There's very little habitat for wildlife. And the emissions from mowing are really high. In Harris County, there was a study that happened a couple of years ago that showed that the amount of mowing that we do in our county is the equivalent of putting about 3.6 million cars on the road. That's a huge burden for a lot of communities. And whenever you mow, you make the roots shorter, and it makes it so that the water can't penetrate as well. But by doing these nature schools, I love the prairie concept on that campus and the food. You can make it more absorptive, more cooling, more attractive, more able to be used for things like environmental education. Next. And so we did this at a school called Jefferson Early Learning Center, where we converted, and I should have had a slide here so you can see it, worked with a really great architecture group called PBK. And we took what would have been a traditional landscape and created about 4.5 acres of prairie wetlands on the campus. So it's a little bit of almost like a little national park. And so now that campus is used by outdoor educators to do lessons. We trained up the teachers to use the outdoors, gave them a history, gave them a natural history, brought in Texas A&M Forest Service. They did training. And then we did this triple bottom line analysis with a group called McMack CX. And in many ways, what it showed was, what are kind of the health benefits, the biodiversity benefits, and the access benefits over that life cycle of that school. All right, next. And one of the things that I've worked a lot on are urban grasslands. And so, as we take a look at One Health interventions, I think that the exciting thing is that so many of our ecosystems and ecosystem types can be useful in even ways that we don't often perceive. So this is in the middle of the Texas Medical Center. This is called the MD Anderson Prairie. And I've measured temperatures there just to see what is it like to have, all of this cooling through these plants as opposed to just lawn. And so this is something that we're interested in doing more of, is taking land out of mowing if it doesn't need to be mowed. Let's use a better type of landscape. And this is a highly imperiled ecosystem, by the way, the coastal prairie. So just like in Missouri, there's not nearly as much of it as there used to be. Click. So what's happening now? What's happening now is we are finding our footing as a group. But one thing that's encouraging is that we're starting to have groups like Houston Methodist, Health Equity Collective, and other health-related groups coming to the table now with urban planners and conservationists and others and environmental justice folks to have these conversations and to talk about how can we better intersect with each other and maybe find that funding, like Roger was saying, like how can we find health funding to do work that is also uplifting for conservation and biodiversity and environmental health. So how can we meet in the middle, as it were? And so, like I said, it's fairly nascent, pretty new, but we're working our way down the field, and we're trying to go in on, have you encouraged people to organize around the International City Nature Challenge? Yes, I used to organize the regional group. So that's a really great way of getting to learn kind of what are the other residents of that neighborhood. So we're looking at joint funding opportunities between healthcare and conservation. We are looking to do a bus tour this fall around what is it like to go down a watershed and look from a One Health perspective instead of just a normal built environment perspective. So having different competencies on that bus so that we can start to learn each other's language and things like that. So that's what I got.
All right, I had mute on. That was great, Jaime. Thank you so much for all those insights. They reinforced what Roger was talking about. And we do have quite a few questions. So I'll just ask you one, and then I'll ask you both a couple really quickly here. So how do we foster ecological literacy in healthcare? What does that look like, and how is that working? And Jaime, you could start, and then Roger, you can jump in as well.
Yeah, I think part of it is that I think it meant, and you know, Roger was talking about this a little bit as well, is I think we all don't know what we don't know. And so I think that if we can tell in a much more succinct way, and I think that, you know, a nature communications campaign is a great idea, kind of what is I always think about community health as sometimes what we think about is, you know, community health starts at a zero, and then as you add assets, either food gardens or wildlife habitat or parks or other things, it goes up from there. What I do know from the research is that in many communities, it's not really starting at zero, because if you're living in a very highly concretized, very hot neighborhood, it's shown to be more stressful. It's shown to be unhealthy. So I think part of knowing the value of nature, and that if it's absent or highly deficient, so nature quant, Roger mentioned that earlier, I used that as well, and the neighborhood Gulfton that I'm working in has a nature quant score of like 19 out of 100. So at that point, that's a very unhealthy key measure right there, not just the health itself. So I think that part of it is telling stories that resonate with caregivers and finding those on-ramps where you're able to, you know, to coordinate. Unfortunately, the Health and Nature Alliance, I think, is going to make a lot of push with that. So we can, you know, work with them on that.
Thanks, Jaime. Roger, would you add?
I would add this. I would add that we need to show up.
Mm-hmm.
Because the Missouri Foundation for Health, in our case, I had a dinner with them, and then they started showing up in our spaces. I mean, you've got a Missouri Foundation for Health program officer. I walked out of a turkey biology presentation. You know, they showed up and they started listening. So one thing we're doing here and then even nationally is we're showing up in the public health department. And you know what you find? When I first went into our public health department, I thought they might say, hey, you know, hey, hippy dippy guy, right? What do you mean nature now? Oh, no, no. The meeting ended with, well, do you want to collaborate? Yes, this checks every preventative health box we know. So then we're also we've got a very deep relationship with the American College of Lifestyle Medicine. We're going to have a delegation, and the Missouri Department of Conservation is going to have a table at the American College of Lifestyle Medicine's annual meeting in November. We need to show up, and I will tell you, when we show up, they want to collaborate. They've kind of been waiting for it, but they don't know what to do or how to do it. And so that's one thing. The other thing is, and Jaime and I, boy, did we connect on LinkedIn about this before we even met each other in person. It's like the pie's not big enough. I've been doing conservation work since 1996. The amount of money going into conservation has remained constant at 1.5%.
Yeah.
We can't do it this way. So healthcare, did a lot of my work in Missouri on a foundation that had about $16 million. We got a lot of their funding for landscape scale conservation. The Missouri Foundation for Health is $1.6 billion.
Mm-hmm.
Now, are we going to get the vast majority of that? No, not at all. If we got a sliver, it's a game changer. So that's why we were really pleased to be able to get a health conversion foundation to buy into this model.
So a couple more questions really quickly here, and maybe we can stay an extra few minutes for people who want to keep listening. Jennifer asked, are there opportunities to work with zoos and aquariums on One Health? And Mohammed asked, what about the Global South and what can we do with One Health?
I will just say that one of the people that came to our latest meeting is from the Houston Zoo. So they're looking to do in-community programming now. And so we're excited to be working with them to kind of help kind of frame this up and to learn from them as well, because I think it just makes a heck of a lot of sense that, you know, it's the same thing, like the zoo sees more annual visitors than all the conservation groups combined. So it's kind of a no-brainer from our perspective that zoos could be kind of a spear point for some of this stuff, I think. So the people aren't going just to the zoo and they're not they're having that relationship with the zoo they've always had, but they can start to internalize, no, I'm not going to the zoo all the time. I'm in my neighborhood and I'm seeing all these connections and things like that. So I think it's a great connection if you can make it.
Is there anything else on zoos, aquariums, the global south?
Global South, I would just say that, and I'll try to get there, but I would say we're relooking at a pattern that's occurred in the past. I've
Yeah.
become very interested in Frederick Law Olmsted, the abolitionist who designed Central Park. And he helped inculcate the notion of even time and nature prescriptions in the late 19th, early 20th, late 19th century. And he did it around sanitation and public health. Now we have chronic disease.
Mhm.
That chronic disease is a global issue. It's in the
Yep.
global south
Yep.
increasingly. We need a framework of these systems around us need to make us healthy, not be extractive and harm us. Now, I don't know where the global south that was, but this pattern is implementable anywhere.
Yeah.
Well, thanks, Roger. Jaime, anything else? We'll ask one more question. There's so many good questions. And then would you two be willing to answer a couple of these that we can then send back out to the group? Everyone will get a recording. Everybody will get the chat. Everybody will get everything.
Yeah. I wanted to see this question from Sarah Rudolph. Like,
Yes, that was the other one.
how
Thank
do
you.
we avoid reinforcing the idea that nature exists solely for human consumption? I think this is like really, really difficult. When we did the Greener Gulfton plan and we did the A-Leaf plan, we had to continually hold open a metaphorical chair for wildlife as a stakeholder, because obviously they're not going to show up to the meetings, but we made it a point to say, okay, well, you know, what are some of the things, the decisions that since you have invited us in and we're doing kind of a One Health lens, like how can we continually tell the message of who lives in the community that aren't people, right? And how is this impacting them? And fortunately, we were working with a community that wanted their children to see more nature. So we were kind of blessed in that way. But I think it's finding ways, and I wish I had the solution for that, to ensure that when you're going into these planning processes, that all the stakeholders, even the ones who can't speak, are represented. And that's just good policy anyway.
It's a great question. And I mean, just practically, what we have done is we have conservation organizations engaged that won't let it go, and that's their mission. And practically I would just say again, on the 201 acre park, the doing a baseline ecological measurement. What's there? What's the ecological management plan? There is no way currently, and I'm not casting aspersions on them, healthcare institutions, unless they have you, Jaime, in proximity, are going to bake in, right, the notion of biodiversity. I mean, that's our seat at the table.
Right.
We just say that's an essential determinant of this, and here's the methods.
Right.
I mean, that's my highest passion. Here I'm talking nature and health. I've spent much of my adult life trying to help nature. I just come to the realization that doing these sorts of things, we've got to change the game to get enough human interest in it.
Yeah.
Sarah was the one that asked that question.
Yep. Yep.
Total
Yep.
values aligned, right?
Yep.
I care so much about all that. Most people, unfortunately, don't even ask that question.
Right. Right.
Well, I cannot thank you both. We have so many other questions. This was absolutely fantastic. Thanks, Carrie, also to you for all of the background work and support for the webinar. Any final thoughts before we close up? Jaime, Roger, one thing you want to leave the audience with?
I would just say, there are a growing number of programs around the country around One Health, and planetary health is obviously very much ascendant as well. And just looking for those connectivity points, I think is great.
I think that what Jaime's doing, what we're trying to do here, I really do believe it's the next generation of conservation.
Mhm.
And it's exciting at this point in my career to be at the forefront. People on here that are in a younger generation, keep pushing for those interconnections. Don't allow us to be siloed. Let's push, push, push for the interconnections. Because that's the only way we're also going back to that framing that I did with what's gone wrong. We should be fighting for policy at that interconnection,
Yeah.
not just models on the ground. We should be fighting to fix all those things in interrelationship. And I'm in a fighting mood these days. So,
Yeah.
there's that.
I think we all need to be in a fighting mood. Great words to close with. Carrie had some final slides. We'll include those in what we send. You'll all get a recording, but I cannot thank you two enough for all the work you're doing, and everybody on this webinar, all the work you are doing and these fantastic questions. And we'll try and answer a few more of those if you both don't mind and get it out to the group. But look at all the hearts and hands, you two. Thank you so, so much. And
Thank
thanks,
you.
everybody. Really appreciate it. Take care, everybody.
Bye-bye.